Welcome to my webinar on how you can use the Healthy Potential Strategy System within your own online virtual clinic. Probably you're here because you want to know how health coaches can build their own new and rewarding private practice online. I'm going to show you how you can do it without wasting time and money on things that don't work. Have you been hearing? Perhaps you already know that experienced health professionals are sick of working in corporate-controlled healthcare. Experienced health coaches, plus a number of folks like nurses and other clinical professionals, have been feeling tired of working for an uncaring and controlling corporate system. Are you wondering about how to become an independent health coach in your own private practice? And wondering how you might work from home as a private practitioner? I'm talking about health coaches who work in corporate programs at insurance companies, hospitals, and workplace wellness programs, but also nurses, physician assistants, dietitians, nutritionists, even respiratory therapists, lab techs, radiology technician, or physical therapy technicians. Since COVID, have you considered such a move but do not know how to start? You can join us now to learn how to implement your own health coaching system. A health coaching system that really works. Learn how you can find and implement a system that attracts top-notch coaching clients. Become a health coach with your own novel and scientific, evidence-based coaching system. Using an evidence-based system that most other health coaches do not have. You can manage your own online virtual clinic and do so from your own home. Are you wondering, well, who can do this? Perhaps you're currently a health coach working in a corporate setting, but weary of being told how to deal with your clients or how to run your coaching practice. Perhaps you are a trained healthcare professional who wants to become a health coach, but you are struggling with how to even begin. Currently struggling with how you might set up your own virtual private coaching program. Have you investigated it, but you're frustrated trying to pull together all the resources you need? Do you even know where you might begin to find the resources you might need? Or do you want to quickly move on and immediately concentrate on providing services to help clients prevent the leading causes of death and morbidity? If so, we have the best strategy and the tool set available for you now. As we get into this, who am I? My name is Tom Bender. I have several professional degrees, an MD plus an MPH. My board certification is in preventive medicine. I spent 25 years in a variety of leadership positions at the Centers for Disease Control and Prevention, and then I spent an additional 25 years in the private practice of clinical preventive medicine. And when I finally retired from my private practice of clinical preventive medicine, I wanted to find a way to work with patients from home and to recapture the joy of helping others, and to do so virtually, all using the newest technology and using what I had learned as a board-certified physician and an epidemiologist and a university professor, without having to give up on my long-term strategy for prevention, without having to just guess about patient risks, without having to wonder about what their laboratory results might show if we were in clinic, or how to track their progress over time. I wanted a virtual system that supported my strategy well enough to identify my client risks, especially for the leading causes of death and misery in the United States, that documents their physical findings and their current laboratory results, and gets a measure of their readiness for change, and then permits the client to discuss these findings with me, which obviously helps to motivate them to lower their risks, and importantly, allows us both to track their improvements over time. Here's what Michelle told me. She said, "Dr. Bender's program puts my mind at ease. I especially like his system for obtaining laboratory studies. I know what I can do further based on my results to lower and monitor my risks." Clients love visiting my new virtual clinic, but here's the issue for new coaches in private practice. Developing your own system with a detailed and proven strategy takes years of research and fussing with rapidly changing technologies. However, we can save months of setup time for you. We will build your virtual clinic and set up the most useful clinical tools. We will develop your clinic website. We will cobble together all your software applications, and we will include lab testing for clients. Plus, we'll ship to clients their own vital physical measurement equipment and provide access to a great HIPAA compliance system to use in your clinic. Your system for electronic health records and client management with your HIPAA compliant clinic rooms and your own client waiting room at Zoom. Importantly, we also provide ongoing preventive and clinical medicine consultation. Consultation to support you as a new or existing private health coach, both one-on-one and consultation in small colleague groups. No need to feel alone or isolated as a private practice health coach. Are you one of those folks that have discussed going into private practice with others, not realizing how difficult and time-consuming this might be? Were your family and friends initially supportive, but with all the delays, are they now growing skeptical and now starting to see your business efforts as a hobby? Do you constantly worry about a to-do list that never gets below 100 items, with none ever fully done? Are you feeling guilty because you put charges on your credit card, expecting profits to begin soon? But profits now seem hard to reach and far off in the future. Are you feeling stress over dwindling confidence, wondering if you actually have a system suitable for top-level coaching? Sometimes, are you feeling like a loathsome imposter? If you fear you might get to this place, don't. If you're already in this place, get out. Here's an opportunity to move forward without these miseries, to show profit statements, not credit card statements, to your family. And without hesitating, you will feel well equipped to deal with clients. You can regain your confidence and regain that sweet, rewarding feeling that comes with truly helping others, and yet know that your business is one of the best out there, but with the low overhead that comes from working at home. So, if you are a health coach going private without a strategy for identifying major health risks for your clients, or the tools to help them track their individual progress over time, if you are a recent graduate of an integrative or functional medicine training program, perhaps with certification, but struggling with where to start in developing your own practice website, your client management system, or the clarity on how to attract clientele to what you have to offer. Perhaps you're a nurse or other healthcare provider who came through the original SARS-CoV-19 epidemic, totally exhausted and frustrated with corporate healthcare, but now wants to work more freely and independently as a private health coach online from home. Maybe you are someone who has successfully arranged your own lifestyle for wellness and nicely managed your own diet and fitness efforts, to the point that many others consider you an expert in the field of wellness, lifestyle, and health. Have you already tried endlessly searching for the best practice management system, only to find that none of them are complete? Have you attempted to build your own website, email marketing system, social media pages, and a client management system that is HIPAA compliant, and so on, all without adequate support and maintenance or security measures, trying to cobble together multiple platforms for scheduling, client management, medical records, Zoom meetings, e-commerce, and email marketing? Even giving guest lectures to neighbors at the local library conference room, but then not having a system to deal with anyone that has interest? Have you sent cold traffic messages to lists of folks on social media platforms like Facebook or LinkedIn, only to be ignored or to then not have a system to properly engage them? Purchasing multiple shiny object software solutions, but finding them totally unusable or inadequate and without support. Have you been rolling in multiple training courses, but rarely finish them and never completely have designed your coaching program? Have you been searching for solutions to correct this misery so you can get to the good feeling of finally helping folks? Do you need to get rid of everything you don't want, but keep what you do want? Well, here is my promise for this video. I will explain how health coaches can now implement a system in private practice that really works. Exactly how we will fix this misery without unnecessarily struggling, so you can quickly feel the rewards of helping clients. Before I explain how our system and services can be a tremendous help to you, let me confirm that I have nothing for sale on this webinar. But if you stay until the end, you will be eligible for several gifts. Some useful additional free video training I located, entitled The Basics of Motivational Interviewing, plus a free 16-page ebook of mine you can use with your clients, entitled How to Get Motivated. Our program is for you if you just want to get started, but especially if you've tried everything. Have you tried to buy your own domain? Have you tried to build your own website? Have you set up your own email marketing system? Have you been searching for your own client records management system? Have you been trying to create your strategy for identifying individual client risks? Have you been searching for a system that provides laboratory testing? Have you been searching for a system that provides vital measurement equipment for clients? Have you been searching for a system that might even ship your recommended supplements to clients? Have you been a victim of sales promotions that got you nowhere and ended up being way too difficult for you to use on your own? Have you been attracted to promotions that lied to you? Yes, actual lies. This might explain why everything you've been told to do to make it better is making it worse. So now you have a choice: the easy way or the hard way. Hard way number one: it is a myth that an experienced healthcare provider can easily do this on their own. You know that it is a terrible struggle, fraught with problems. You remember Murphy's Law: if anything can go wrong, it will. It takes way too long to develop the skills to build and maintain a top-notch system. It is so very costly. It takes time that could be better spent with clients. And then there is hard way number two. Should you hire someone to develop your system? How will they represent you? They do not know what you want to say or do. It makes it worse. You still must provide all the branding and content. It takes forever and leads to so much burnout. Then I developed this one method for health coaches that fixes every problem with scientifically approaching client health and wellness. First, identify their risks of arteriosclerotic cardiovascular disease. ASCVD is the leading cause of death and misery in the United States. Then you lower those risks as you proceed through lifestyle coaching, and then you document their improvements over time. Using this system, you will finally be able to feel anew the pleasure of helping others with success. You will know your work is scientifically sound. You will provide long-lasting results and ongoing client follow-up. Let's introduce the Healthy Potential Strategy System. Here's the 3 simple steps. The system is as easy as A, B, C. There are 3 basic building blocks to the system. How do they fit together? A is for health assessment or appraisal. B is for biological measurements, sometimes known as biometrics. This includes things like height and weight, or body mass index, body fat analysis, blood pressure and pulse, lipid profile, and other important measurements. C stands for change, through coaching, counseling, and consultation. But why assessment? First, it provides solid estimates of your client's actual current health risks. An assessment provides real health data specific to your client and their current risks of disease. No guessing needed. Why assessment? It serves as a baseline data to track improvements over time. It is a scientific and strategic framework that guides all your coaching techniques. Why biometrics? These client-based measures greatly strengthen the value of the assessment or appraisal process. Why biometrics? Well, clients obtain all critical bodily physical data, things such as height, weight, body mass index, waist-hip ratio, body fat analysis. And clients obtain all critical body functional data such as pulse and systolic and diastolic blood pressure. Clients also obtain valuable laboratory biochemical and metabolic data that is used to establish baselines and follow improvements. For example, clients obtain lipid profiles, which include total cholesterol, LDL cholesterol, HDL cholesterol, VLDL cholesterol, and triglycerides, and other lab tests like fasting blood glucose, hemoglobin A1C, highly sensitive CRP or cardiac CRP, and other tests as needed. Including these important biometrics allow you to base your assessment of risk on real physical and lab data and using the latest scientific approach, not myths. What else? These biological measurements provide early client motivation and feedback. And as you can tell, they serve as a baseline for tracking changes over time. Now, why coaching, counseling, consultation? For change. Consultation that we provide to you greatly strengthens the medical aspects of your coaching program. Our consultation provides critical support during system setup, as well as advice on managing and maintaining your system. With professional, clinical, medical backup, clients know you are using a professional and state-of-the-art clinical approach. Our consultation helps you reduce any concerns about your skill set, and it promotes you rapidly as becoming a VIP health coach with great system and a great program. With backup consultation, clients know you have ongoing support in medicine, diet, nutrition, fitness, and exercise. So remember the 3 steps of the Healthy Potential Strategy System: assessment or appraisal, biometrics, and consultation. In summary, when everything is put together, they are able to end uncertainty. You get to helping clients quickly in under 8 weeks. And to do so with tremendous savings of time, energy, and money. Now, at this point, you might be wondering, but how do I set up and apply the Healthy Potential Strategy System to work with my clients? what tools and techniques are needed to use the Healthy Potential Strategy System. Are you a new health coach just starting out? We help you create your website, strategy system, everything. We work with all our coaches to set up your email and client management system. We help you set up your virtual coaching system, and we arrange shipping of client equipment. We help you set up your laboratory account and create your health coaching platform. We also work with you to set up your HIPAA-compliant coaching platform and create your Zoom room for client sessions. Here's a question. Did you try all of this on your own? Do you want to try all of this on your own? Do you want to spend the most time, money, and energy and yet make the least amount of progress? Or do you want to spend the least amount of time, money, and energy and make the most amount of progress? People tell me all the time, I'm facing too many distractions to build my coaching system and I'll never get to the rewards of being a health coach. So how can you make real progress? My patients use this same system for years to end their worries and to get to wellness. I have been fortunate to have a fascinating career working with such great people. I now want to pass on much of what I've learned. How many days out of the last 30 have you spent trying to design from scratch what is turning out to be a frustrating and inadequate coaching system? How many days out of the last 30, perhaps 25 days, working on a frustrating and inadequate coaching system? How many days out of the last 30 should you have spent doing things you would rather be doing as you work with clients? Things like onboarding new clients, knowing you can really help them. For example, your time would have been better spent helping clients identify their disease risks and helping them see their improvements unfold. But in the last 30 days, perhaps 25 of them, some of you were struggling to build a system for coaching, not sure of how to begin, concerned about what to include, not sure of your niche, concerned about what health issues are the most important. But you should be living every day without delay, coaching with confidence. But you should be living every day completing each and every session with satisfaction. But you should be living every day feeling very rewarded, knowing that you are really helping your clients. The difference is 25 days that you should be living your life feeling rewarded, not 300 days over the past 12 months, or 8 years out of the next 10, wasted because of a poor coaching system, wasted because you didn't have the right system, process, and methods to follow. How much money have you wasted with online searching, false starts, and buying things that haven't worked? $1,000? $2,000? How much money haven't you made in the time you've been struggling with no system or a poor system? Another $1,000? $2,000? Without a mentor or support, you wasted money, you lost money, and you lost the time of your life. How much time and money is it costing you not to be coaching your clients with a system like the Healthy Potential System? What is the best solution to help you reach your goals? Should you hope it will go away by itself? It won't. This is like banging your head against a brick wall. When developing this system, I asked myself a simple question. If the tools, process, and information I used led me to waste time, energy, and money, then it's time to find new information, tools, and processes so I can get straight to rewarding coaching fast. Look, whether you're an existing health coach or someone interested in starting out, here's how we can fix this for you today, starting today. And here's what I suggest. I'd like to give you the opportunity to leverage what I've learned about virtual clinics I've already gone through the process of investing and wasting time and money in solutions, having done everything the wrong way and learning the hard way how to do this. But as a prevention specialist who for years did personally coach patients or clients to wellness and health in a brick and mortar clinic, and who now has figured out a unique system for virtual coaching so that others can do the same, I would like to set up a blueprint call with you if you are interested, 100% completely free. Let's call it a How to Get into Rewarding Coaching Using the Healthy Potential System and Tools Blueprint call. And during this call, if you're the right coach or potential coach, we will personally put together a complete blueprint for you so you can stop and get out of or avoid and prevent these frustrations fast, and how you can use this customized blueprint to fast track yourself to feeling rewarded as a health coach. You will leave this call with clarity on the exact system I've used with my patients to guide them to wellness and health. This is not a sales pitch call. There is no high-pressure pitch that will happen at the end of this call. I will ask you if you would like my help implementing your customized virtual clinic blueprint, and you can simply answer yes or no. However, for obvious reasons, I can only bring on a select few clients each month and help them get to rewarding coaching using my Healthy Potential system and tools. When you schedule your appointment, I will ask that you complete a brief form before the call so that I will have an idea how to best help you. Now, early in the webinar, I promised 2 gifts for you if you stayed until the end. Here's how to obtain gift 1 of 2. Motivational interviewing, as you probably know, is the core approach to good coaching. This link is to video training on motivational interviewing. This is not my training, but I like this series as a refresher. And here is a link to gift 2 of 2. It is our ebook that you may use with your clients to help them get motivated. I will add the hyperlinks to both gifts at the end of this webinar video. Look, the best thing that will come from our call is that you love the customized plan I create for you. And you want to become a mentored coach and work with me. Scheduling this call is the single most important thing you can do right now in order to get going as a happy health coach. Do not postpone. You know this is a good opportunity to gain the help you want and need. Click the button to book a call. The book a call link is myhealthypotential.net/book-a-call. Now meet Marshall. He said, "My blood pressure was extremely high and I was an almost pack-a-day smoker. We got my blood pressure under control, then began a stop smoking regimen. If it hadn't been for your persistence, my outlook would most likely be different, way different today, if I was even around to speak of it, and I'm forever grateful." Now select the button to get the book a call link, and we'll talk to you on the phone. Now, for some who are still listening, you may have some questions, and here are some frequently asked questions. First of all, what is a health coach? A health coach is a professional who uses evidence-based conversations and strategies to engage patients, often also known as clients, in behavior change maneuvers that improve their health. As experts on human behavior and motivation, health coaches help clients achieve their health goals and empower them to integrate healthy habits into their lifestyles. Are health coaches in high demand? The global health coach market size in dollars is $16 billion in 2023 and is currently on track to hit $29 billion by 2032. The role of coaches in healthcare is becoming increasingly vital as the demand for coaching significantly outstrips the supply. As you may have observed, existing healthcare personnel in clinic are all very rushed. What is the situation regarding licensing of health coaches? There are no state or federal regulations on certification or licensing dealing with the term health coach, nor is there an authoritative, widely accepted accrediting body with educational or training standards, although these are emerging. However, many who work online or offline in person to promote wellness are licensed professionals in their state. How might I protect myself as a health coach from liability? We recommend that you develop a health coaching professional waiver of liability. This is a must for anyone who works with clients and provides health advice. It explains the risks and possible outcomes of taking your advice, and it allows clients to absolve you of liability. It helps protect you from being sued if someone gets sick or injured due to the advice you provided, or if they allege they have suffered damages. What do you mean by the name virtual clinic for health coaches? Virtual property is a digital asset or object that can be bought, sold, traded, or owned in a digital or virtual environment. It can include things like virtual real estate, a unique parcel of land in a virtual world, such as the metaverse, that can be used to create income-generating properties. For example, you could build leasable buildings or interactive venues that charge admission or promote a brand. Is this clinic system interactive? It is very interactive, both synchronously in person or via chat with individual clients or small groups, and asynchronously using text messages and email messages. While you may design training courses as part of your several packages that would not be interactive, this system is more than just client training. Is it virtual reality? Your clinic may involve a computer-generated environment with scenes and objects that appear to be real, making the user feel they are immersed in their surroundings. At the current time, your clinic is perceived via their computer screen and not through a device known as a virtual reality headset or helmet. Is this artificial intelligence? Artificial intelligence, sometimes abbreviated as AI, is the science of making machines that can think like humans. It can do things that are considered smart. AI technology can process large amounts of data in ways unlike humans. The goal for AI is to be able to do things such as recognize patterns, make decisions, and judge like humans. Your clinic will use AI to support you as you measure disease risks for your clients. This field is changing rapidly, and we are keen to stay on the top of the use of tools that will support your work as a coach, including AI. Who is available to work with me? We have available mentors and staff trained in medicine and public health, nutrition, exercise physiology, law and intellectual property, computer science, software engineering, and the graphic arts, as well as medical and virtual assistance. I hope these answers to frequent questions have added useful details to our webinar. I want you to book a call now if you're so inclined. Do not postpone this. If you want to learn more, just book a call at our appointment calendar link right now. I look forward to talking to you about your hopes and plans as an existing or future health